Hello, I'm Dr. Bruce Eimer, and I'm here to briefly tell you about a very exciting conference that is going to be occurring in sunny Daytona Beach in May this spring. This conference is the 2018 annual Hypno Expo, which is sponsored by the International Medical and Dental Hypnotherapy Association, IMDHA. To find out more about this on the web, just go to hypnoexpo.com. It's an easy URL to remember, hypnoexpo.com. Now, this conference is going to be running from May 18th through May 20th at the Daytona Beach Resort. There'll be pre-conference workshops beginning on May 15th and post-conference workshops beginning on Monday, May 21st. I myself will be teaching a pre-conference workshop on hypnotherapy and mindfulness for taming chronic pain on the dates of Wednesday, May 16th and Thursday, May 17th. Now, let me tell you a little bit about what I'm going to be teaching. For years, I've specialized in helping people with chronic, unrelenting pain find relief and develop more effective pain coping and stress coping strategies. And the most powerful tool that I found to work both for myself in helping me cope with my own daily chronic pain, which is back pain and leg pain due to spinal stenosis and several other spinal diseases, has been a combination of hypnosis and cognitive behavior therapy. I've written several books on the topic, such as the self-help book, which has been widely praised, and it's entitled Hypnotize Yourself Out of Pain Now. Currently, my close friend and colleague, Roy Hunter, and I are finishing up our current book, which is entitled Taming Your Chronic Pain, a mindful approach for creating lasting pain relief. Hopefully, this book will be available come this May at the conference, and it'll be for sale on Amazon.com. It's a self-help book, but we also hope that therapists and professional hypnotherapists will also find it useful. Over the years, I've refined my approach or approaches based on finding out what works and what doesn't, where the rubber meets the road, which is working with people that are in dire pain and often addicted to dangerous opioid medications. In fact, I have worked for the last 7 years in an outpatient, hospital-based medical pain clinic where my job was to evaluate new patients to assess their personalities, their risks for abusing opioid medications, and also to assess their appropriateness for psychological interventions to help them to deal better with their pain. Interventions such as hypnotherapy, mindfulness, and cognitive behavior therapy. Now, I must tell you that having chronic pain myself is a very sobering thing, because when I read literature written by so-called experts on the effectiveness of psychological approaches or whatever their pet approaches happen to be for treating people with chronic pain, I view those articles and what they say through the lens of my own experience. And I know that chronic pain is undertreated. It is often relegated to the use of medications or the office of a drug prescribing psychiatrist. And most doctors don't know what to do with people that have unrelenting pain. In fact, with the recent clampdown on the prescription of opiates, now there's a very strong tendency in most medical practices and medical centers to refer patients to pain clinics because physicians are anxious about prescribing opioids on a long-term basis. And they're very glad to refer their patients to practitioners who specialize in psychological approaches so that it both covers them for a liability perspective, but also has the potential for significantly helping their patients. Hypnosis has been proven to be the most effective and the oldest non-drug remedy for the treatment of pain, and in fact, it has been endorsed by the National Institute of Health, as well as the American Psychiatric Association, the American Medical Association, and the American Psychological Association, of which I am a fellow, in terms of it being an evidence-based treatment for the treatment of chronic pain. What I have found in working with hundreds of people who suffer from chronic pain is that they are looking for a source of hope. Many of these folks have lost hope and have become alienated because most people view them as being a pain. I want to, just for a moment, make mention of the excellent work that has been done and published in several books by the late Michael Ellner, who recently passed away and was a great teacher and practitioner in the field of professional hypnotherapy. His approach, which is being carried on by Kelly Woods and several colleagues, is called Hope Coaching. Now, I have to say that I've developed my approaches independently of Michael Ellner. However, when I read the books on Hope Coaching, I recognized what a confluence and commonality there is between his work and mine. Because if you cannot promote or activate hope in your initial contact with someone who comes to you as a potential client for help in getting pain relief, you will lose that client. They will not come back. So I found that it's very important to begin early on in your first contact, in my first contact with a new client for pain, to promote hope and to communicate that I do understand what that individual is going through and that I do need to find out details in order to collaboratively with that client develop an individualized treatment plan using hypnosis to help him or her to find relief that is portable, as Dan Cleary teaches, and that person can easily begin to use. Therefore, I have now come to the practice of almost always in the first session, before the client leaves that first intake evaluation, of giving them an initial positive experience of hypnosis with very positive ego-strengthening post-hypnotic suggestions before concluding the session. In the workshop that I'm going to be teaching in May at IMDHA in sunny Daytona Beach, we will have 2 days with which to delve deeply into the field of pain mechanisms and pain management, and to look at in great detail the effectiveness and the relevance of applying hypnotic techniques as a hypnotherapist to seeking out and treating and helping more clients who would be seeing you primarily to help them cope better with their chronic pain for which they have not gotten significant relief from anyone else or anything else. The workshop will be an intimate one, whether we have 5 people or we have 25 people. There'll be informative lectures by myself, demonstrations that I'll conduct to illustrate techniques that I've described and for which you'll get handouts that'll describe how to do the techniques in a step-by-step way. There'll be some videos to watch, not a lot, but enough to give you some illustrations of me working with real patients who have given me authorization to use their videos for teaching purposes. There'll be the opportunity for workshop participants to volunteer to be demonstration subjects. There'll be practice breakout sessions and some experiential exercises as well. This will be a 2-day intensive on the use of hypnosis power tools and mindfulness for taming chronic pain. I use the term taming chronic pain because I have discovered that in order to be effective in helping yourself or helping anyone else to cope with pain effectively, it is important to, as Antoine Saint-Exupéry wrote in the 1940s classic fairy tale, The Little Prince, that to tame something is to establish ties, to establish a warm relationship, and to identify mutual needs. And the fact is that pain, while not being pleasant, which by definition it is the opposite of pleasure, pain is a signal from your body to your mind that there's something wrong. Pain is felt in the body and perceived in the mind, and it is a signal. And so the issue then becomes, how do we interpret that signal? For pain that is new, i.e. acute pain, it becomes necessary to make sure that any client that has acute pain seeks immediate medical and appropriate medical attention. We don't want to do hypnosis to mask an active, progressive, possibly serious or fatal medical illness, such as a tumor, let's say, or somebody that is having a heart attack. For pain that lasts and doesn't respond to appropriate medical treatments and has been unrelenting and persistent for over 3 months, we term that type of pain chronic, and then it's a whole different story. And hypnosis has a role to play in helping people who have chronic pain to learn how to live more comfortably on a day-to-day basis. That is not to say that hypnosis does not have a role to play in helping people with acute pain to manage their anxiety before and after they've been medically evaluated, because it does. And hypnosis has a very, very powerful and effective role to play in preparing people for invasive medical procedures which activate anxiety, things such as surgery, naturally, understandably. Over the years, I have developed an approach to helping people to manage chronic pain more effectively by creating sort of a protocol that allows me to develop empathy and compassion for the individual and to teach that patient or client, depending upon where I'm seeing him or her, how to develop and have true self-compassion for him or herself, to be able to treat him or herself kindly, okay? Many people with chronic pain have histories of trauma and are very hard on themselves, and they need to be able to release past traumas and emotional burdens and forgive themselves so they can get past their past and effectively use coping strategies in the present. I've developed a formula which Roy Hunter and I are writing about in our current book, Taming Your Chronic Pain, and it is called the AWARE formula, which basically translates into the AWARE hypnotherapy model. The letters in the word AWARE, which is an acronym, stand for A for accept, that is, one needs to accept oneself and the fact that one has pain, even though one doesn't like it. One has to be helped to accept oneself with the pain, and despite all of the problems that the client has and brings to you. The next letter in AWARE is W, which stands for watch. And this is actually both a combination of mindfulness and just common sense assessment, which basically means working with the client to help him or her to watch and discover their coping strategies and automatic habit patterns such that they become more aware of what they do and how they treat themselves and others as a result of their pain problem and how they deal with the pain. This becomes an opportunity to catalog the client's coping techniques or automatic habit patterns and to identify targets for change. The next letter in the acronym AWARE stands for adjust, and that is A. Here, what we do is we address coping habits and habit patterns that have been identified as not being healthy, that have been identified as unhelpful. And we utilize various hypnosis techniques and cognitive behavioral techniques to adjust the way in which the client, with the client's permission and full collaboration, the way in which the client utilizes those coping habits, helping the individual not necessarily always to eliminate certain coping strategies, but to change them in a way that makes sense, making adjustments in the way in which the client utilizes him or herself and his habits in order to help him to cope or her more effectively. The next letter in AWARE is R, and that stands for recognize and release. And it becomes very important because when we're working with someone to help them to make positive adaptive changes or adjustments in their behavior, their thinking, and their feeling habits, what ends up happening is it activates old feelings, it activates old issues that people have that have been often preconscious or unconscious, feelings about self and others. And what has to happen is, in order to actually help somebody to make lasting changes, it becomes necessary to help people to recognize emotional burdens that they need to let go of and to release so they can get past their past. And for this, I utilize an appropriate combination of hypnotic regression therapy, which I have worked to a large degree with my mentor Dabney Ewan and my good friend and colleague Roy Hunter on, and which culminated in our 2012 book. That is, Roy Hunter and I wrote The Art of Hypnotic Regression Therapy. So that's published by Crown House Publishing and is available. And I utilize hypnotic regression therapy to help people to discover the origins of some of their dysfunctional coping patterns and to help them to get relief from their, let us say, sense of not being able to make any changes because they feel that their ideas and their coping strategies are fixed and unchangeable. And it's necessary, therefore, to utilize regression techniques through the tool of hypnosis to help people to recognize the origins and to help them to reframe their concepts of self in relation to their recollections of old experiences that essentially are well springs for the way that they are today in their own mind. And being very careful, of course, to distinguish between the client's perceptions and what is current in their mental life versus not being able to actually, with veracity and accuracy, recall old memories, because memory is fallible and we can never know, whether we use hypnotic regression techniques or any other psychological techniques, the facts of what really happened. We are only working with the person's views and feelings and perceptions in the present of the past. And the last letter in AWARE is E, and it stands for Envision and Empower. And I utilize a combination of parts therapy and hypnotic regression techniques to help the person that I'm working with to basically begin to envision him or herself coping better and functioning better in the future, to envision the self being well and more comfortable and more self-reliant and having more efficacy, to view the self in the future as doing things that are desired and in line with the client's core values. Identifying core values is a very important part of the therapy. And we utilize parts therapy in order to identify unconscious conflicts that block the person from getting well and resolve conflicts from different parts of the personality or between different parts of the personality that need to be resolved from the standpoint of being the therapist and being a mediator as opposed to being an arbitrator, utilizing hypnotic techniques. And that often helps to resolve conflicts that have been blocking the individual from actually benefiting from the different treatments that they have had for their pain. Well, we're pretty much running out of time. And what I do want to say is that it's not possible to tell you more other than please check out hypnoexpo.com. Please have a look if you're interested. Go on Amazon.com and have a look at my book, Hypnotize Yourself Out of Pain Now. I also wrote a book. It was the first book that I published back in 1998 called Pain Management Psychotherapy, a clinical guide. You might want to have a look at that. There's lots of reviews and synopses and so forth of these books on Amazon.com. So if you don't find it relevant, then you don't have to spend your money on those books. But if you're interested after reviewing the blurbs, synopses, and reviews, then those books can be ordered. And I really hope that more professional hypnotherapists and hypnotherapists in training begin to view the relevance and the applicability of hypnosis for helping people that have chronic pain to live more comfortable lives, more functional lives with less disability and less impairment. And of course, to address the attendant emotional overlay to living with daily chronic pain. That is anxiety, depression, anger, alienation, and resentment. Well, thank you for listening. And if you are an aspiring hypnotherapist or you are a practicing hypnotherapist, I'd like to invite you to join me for this productive, exciting, and fun 2 days that I can guarantee we're going to have at the Hypno Expo in Daytona Beach on May 16th and 17th. 2 days of learning, of mingling, of meeting new people, of exchanging ideas, and you'll come back, I can guarantee it, with a toolkit of powerful techniques and a therapist manual for immediately employing in your practice. Thank you for listening and hope to see you in Daytona.